I've always been fascinated by how our brains work, especially when it comes to mood disorders like bipolar disorder. You've probably heard of it, but do you really know what it means for those who live with it? Well, today we're going to dive into the world of bipolar disorder, exploring its symptoms, causes, and how it affects millions of people worldwide. So let's get started on this roller coaster ride through the human mind. Bipolar disorder is a complex mental health condition characterized by extreme mood swings. But why do we call it bipolar? Well, it's because people with this disorder experience two distinct poles of emotion, manic highs and depressive lows. These episodes can last for days, weeks, or even months, and they're way more intense than the normal ups and downs we all experience. There are actually different types of bipolar disorder. The two main ones are Bipolar I and Bipolar II. Bipolar I involves full-blown manic episodes, while Bipolar II is characterized by less severe manic episodes called hypomania. It turns out that about 2.8% of adults in the US have bipolar disorder, which is pretty significant when you think about it. Let's take a closer look at what these manic and depressive episodes actually look like. During a manic episode, a person might feel on top of the world. They're full of energy, need less sleep, and might engage in risky behaviors. On the flip side, depressive episodes are the exact opposite. A person might feel hopeless, lose interest in things they usually enjoy, and have trouble concentrating. They might sleep too much or too little, experience changes in appetite, and in severe cases, even have thoughts of suicide. These aren't just mood swings. They're intense episodes that significantly impact a person's life. So, what causes bipolar disorder? Well, scientists think it's a combination of factors. Research shows that genetics play a role. If you have a close relative with bipolar disorder, you're more likely to develop it. But it's not just genes. Environmental factors like stress, trauma, or major life changes can trigger the onset of bipolar disorder in people who are genetically predisposed. Diagnosing bipolar disorder isn't always straightforward. It often involves a comprehensive evaluation by a mental health professional, including a detailed history of mood episodes. Treatment usually involves a combination of medication and therapy. Mood stabilizers, antipsychotics, and antidepressants are commonly used to manage symptoms. Psychotherapy, like cognitive behavioral therapy, can help people learn to manage their condition. There are many misconceptions about bipolar disorder. Let's bust some common myths. With proper treatment and support, many people with bipolar disorder lead fulfilling lives and have successful careers. Support is crucial for people with bipolar disorder, whether from family, friends, support groups, or mental health professionals. Organizations like NAMI and the Depression and Bipolar Support Alliance provide valuable resources and support. Understanding bipolar disorder is the first step towards breaking the stigma surrounding it. With proper treatment and support, people with bipolar disorder can lead fulfilling lives. If you or someone you know might be experiencing symptoms, don't hesitate to reach out for help. Remember, mental health is just as important as physical health.